this is one discussion which I was actually looking forward to, and this discussion was not planned initially. This was something that we thought of, I think, day before, sir, when I called you at night and I
Absolutely.
took your permission that if we could do this. मैं परसों रात को बैठा हुआ था and at night I was very tired. I put on the TV and put on Netflix and I was watching that Kapil Sharma show. And surprisingly, the person I see on that show was Dr. Anupam Sachdeva. But it was an eye opener for me because something that I did not know was revealed to me there. I had never known in last so many years that I met him that an oncologist that I really was always very close to was himself a cancer patient. So that was something which led me to call him late at night and I said कि सर आप आ रहे हैं हमारे event पे. But this is one conversation I want to have because we have oncologists here and we also have warriors and we also have a few patients and we also had someone who lost their loved ones to cancer. So I think this conversation will bring to you the perspective of an oncologist. So, we've had a very small time that has been, a very short time that has been given to me. I would not waste my time on trying to give a context, but let's leave it to him. Sir, you got detected with cancer in 2023, right? 2023. When you were told that you have cancer, what was that first emotion that came about you?
Interestingly, I was diagnosed after a colonoscopy just 2 days before Holi on 2023. And they said that, we'll have to operate on you, and this is what we have found. And that's when I came out of anesthesia after colonoscopy, and they were talking to my wife. I wasn't actually aware at that time. And they asked me, should we tell him? He says, you have to tell him. There is no question of not telling him. So they came to me and they told me that this is what I had. अच्छा, then the next question was, अरे यार होली के दिन करें कि उससे अगले दिन करें? तो they said, मैंने क्या एडवांटेज है क्या डिसएडवांटेज बता दो. तो they said कि होली वाले दिन ज्यादा रश नहीं होता ओटी में, तो we'll have people there who can to look after you much better because the staffing will be there. I said, but होली वाले दिन छुट्टी भी होती है तो staffing कम भी होगी. कहते हैं, one of my juniors, he says, sir, you don't have to worry about staffing. We are your family, we'll be there. So I was operated on Holy Day, and there was no sort of that kind of emotion wasn't there ki this is the end of the story. My feeling was, let's get on with it and see how it goes. When I came out, I wasn't told what were the findings in the OT because I was quite sick. Post the surgery, I was quite sick and in the surgical ICU for a good 24 to 48 hours. Even then, they didn't tell me what are the findings. They said, we have operated and we have made a colostomy. So I said, okay, fine, that's all right. 4 or 5 days later, my wife and my son came and told me, "Arey, we are safe." I said, what is the problem? They said, we got this message from the OT when they were operating that it looks like it is confined locally, but at the same time, there are a lot of tissue in the abdomen and in the liver, which is very, very suspicious. So when they said that, 5 days later, the reports came as normal, including from the urinary bladder, from the liver, from the peritoneal cavity, and from the other. Now, I went through a period of chemotherapy, came out in November. This was in March. I was operated again in November for the reversal of the colostomy. And at that time, it was thought, chalo, theek hai, koi baat nahi, ab to we are through with it. And interestingly, when I went through the surgery in November, I went into shock. I went into renal failure. I was in the surgical ICU for almost 4 to 5 days, came out of it and resumed my life and, went on with it. So I was post that 14, 15 days after that, I was, the surgeon who had operated on me and then the nephrologist who was looking after me and the other people, they came together, said, Anupam, we are sending you home now. I said, भैया तुमने तो मेरे को आउट करके भेज दिया था, वो थर्ड एम्पायर मेरे को वापस भेजा है, ऊपर बैठा हुआ जो थर्ड एम्पायर है उसने वापस भेजा है. So they started laughing and we took it like that only. Now after that I have had 2 relapses of the disease. The last one was in July and I'm on chemotherapy, on immunotherapy and so on and so forth. But I'm carrying on with my life. I'm not that physically active because of my neurological conditions which I've developed. But generally speaking, I'm doing well and I'm taking care of my patients and I don't see them that frequently now, but I do go to the hospital and sort of try to maintain the facade of normalcy, as they say, because that helps me overcome the problems which I have. That's the whole story.
Dr. Sachdeva, it's a very powerful statement to say that, we went back to normalcy. From being an oncologist and stepping into the shoes of a patient yourself, how did your understanding of this condition called cancer change medically, physically, as well as spiritually, emotionally?
I think that being an oncologist helped me in overcoming the condition, because one can look at positive and one can look at negative things. When I was operated, they said there's an 85% chance that you will be cured now. And after chemotherapy, you'll be cured. Then the disease came back and I was operated again in November, last November. Again, the disease came back in July where they told me that you can't undergo another surgery because you will not be able to come out of it. So we did other procedures to remove that. Now, my disease is not there now, but I'm on therapy. But believe you me, I don't think that there was an apprehension in my part that knowing the side effects and knowing the disease put me down. In fact, what helped me is that I knew that there's a 80-85% or now it is down to 50% or whatever chances are there. So I take my chances on that. And I feel that being a doctor, being an oncologist, it has helped me out in coping up with the disease.
Before I move on to the next question, does anyone out here have a question for him? Because you've got an oncologist who's also a patient. Anyone has a question for him? But let's make it real. Anyone? Sir, then my next question to you is, हर इंसान की जिंदगी में who's dealing with cancer, कुछ ना कुछ ऐसे situations आती हैं जब despite being an oncologist, कहीं ना कहीं आपको डर लगता है, कहीं पे challenge लगता है कि क्या होगा, एक uncertainty की feeling आती है. And at that point in time, you need something to anchor you in. Was there a situation, something or someone who became your anchor at that point in time when you felt the weakest?
I think your immediate family is what makes a difference. My son is an oncologist. He was in England when when I got the relapse, and he immediately came down to this place. I told him there's no need of it. It's relapse. We'll take care of it. No, don't worry about it. He said, do you think I can sit there and be comfortable? I'll be more comfortable here. And then he said to me that I have talked to my chief, whom I knew, and she said, there's no question, you go home. So my family, my son, my daughter, my wife stood by me like rocks. And that helped me overcome the things.
वो कहते हैं ना सर, कैंसर बड़े बड़े लोगों को कुछ ना कुछ सिखा देता है. ऐसा क्या लर्निंग है that today you say that you have learnt because of being in a situation, being in the shoes of a patient, and you're sitting on the other side of the table today?
I think what I have learned is to be more empathetic with my patients. I was already very empathetic, and I was constantly talking to the patients and listening to them and giving them advice. But now sitting in their shoes, I'm more empathetic, I'm more tuned to this thing, that there is a human angle to everything. In fact, somebody asked me the other day, and they said, you deal with small children, and when the child is sick, what is your situation? Well, I said, listen, when my child is sick, and when I say my child, it means my child only, is sick, I go through sleepless nights thinking, इसमें कुछ और कर सकता हूँ, इससे किसी और से पूछूं कि कुछ और तो नहीं कर सकते ऐड. And every time I lose a patient, a part of my heart dies with it. There is no question. Every doctor goes through it, every doctor feels it and is empathetic about it, but we have to inure ourselves against too much emotional attachment, because in our line we are dealing with patients, or we were 35 years back, it was like this thing, that a lot of the situation was not as good as it is today. So constantly we were dealing with patients who were mortally sick, and if you were not trying to inure yourself from these situations, you would yourself go sick and become a psychotic patient. So we have been taught in our medical sciences to protect ourselves with that facade of not being that concerned about the patient, at least externally, to protect ourselves. In fact, there's a very important thing which happens in UK. When I was a student there, all the patients, all the doctors and sisters who were involved in the care of a patient who would die would be called for a bereavement meeting. And in that bereavement meeting, where we could speak and tell about our feelings, and the priest would help us overcome our bereavement. It was, that meeting was not only for the parents, it was with the doctors and the sisters who were intimately involved in the care of the patient. So that's very important. Unfortunately, that part is neglected in our country. Poonam ji was here, and she has helped us in building up the department by providing us with a lot of people but tell me, as a hospital, how much money is provided for providing a dietitian during the OPD hours for the OPD of a pediatric oncology OPD, or a counselor. Everything costs money, and the hospital will say, okay, they're not paying for it. Why should they be getting this? Why can't you advise that? So that kind of a thing, that is the kind of ancillary staff and the ancillary healthcare system which we need to set up in each and every hospital to help people come out of it. We do have mandirs and we have gurdwaras in our hospitals also, where patients go for sort of taking solace in their situation. But there is nothing like that for a doctor or a sister. It is, when a doctor goes to a mandir or a gurdwara or whatever is there in the hospital, will that be taken at the back of a mind? Will that be taken as a sign of weakness on our part? Or will it be taken as a sign of strength? We really don't know. We don't have that system. We don't have the systems in place in our country to help you out with that kind of thing. So these are the systems which we need to put in with the help of NGOs and various other organizations.
Dr. Sachdeva, my last question to you. And this is something that is very, very close to my heart, because I was talking about the book that I'm now putting together. It's already done. We've already penned it. It's into design and printing now. And where I've had interviews with oncologists, we've also had interviews with survivors, cancer patients. But today, I'm sitting with someone who's an oncologist as well as a patient, survivor. कैंसर ट्रीटमेंट के अंदर डॉक्टर और मेडिसिन के अलावा पेशेंट का क्या रोल है, so that they are able to fight, have the will to live and become a warrior?
I think patient का major role होता है, and in children it is the parents which make a difference. The way they cope up with the situation and the way they keep themselves happy is very, very important. If you go into a depression during the treatment of this thing, that can be very negative. Because with the depression, your chances of recovery become very less. So I feel that it is important that the patient as well as the parents keep their, I say, अपने को जिंदाबाद रखें. And अगर जिंदाबाद रखोगे, तो you'll come out trumps, not in US but in India trumps, rather than going down. So that is very, very important. You should have the think positive, do positive things, and you will come out well.
सर, आपने भी पॉजिटिविटी की बात करी. एज अ क्लोजिंग नोट, जब हम पॉजिटिविटी की बात करते हैं कैंसर पेशेंट के साथ, तो कैंसर पेशेंट को हम जाके बोलते हैं यार सब ठीक हो जाएगा, डोंट वरी, थिंक पॉजिटिव. और कैंसर पेशेंट कहता है यार कि क्या पॉजिटिविटी बात कर रहे हो, मेरे को ये नहीं पता कि मेरे लिए सुबह होगी नहीं होगी. तो ये पॉजिटिविटी कब टॉक्सिक पॉजिटिविटी बन जाती है, इसके ऊपर 5 सेकंड के अंदर अगर अपना क्लोजिंग नोट.
देखो, एज अ डॉक्टर यू कांट से दिस थिंग कि सब कुछ ठीक हो जाएगा, बिकॉज यू रेज द होप्स ऑफ अ पेशेंट स्काई हाई, and the higher you raise it, the heavier is the fall. It will lead to repercussions when the patient doesn't make it. It will lead to repercussions because the parents, the relatives will get after you and they will start abusing you, that you kept us in the dark. So I think this is the job of a counselor and the person who's there with you to explain the things to them and keep them positive. It doesn't mean that positive does not mean कि तुम कहो जी कि तुम ठीक हो जाओगे. Positive is that you give them hope from day to day and give them a reason for fighting it. It is not, positivity does not mean कि तुम ठीक हो जाओगे. अरे जाना तो हर किसी ने है, किसी ने यहां पर हमेशा के लिए नहीं बैठना. तो अगर वो सिचुएशन आपको पता है, सबको पता है, पर we keep on hoping that a few more days, a few more weeks or so. But I think that is very important that you keep the positivity in the sense that you give them a hope to live on for a day, 2 days, 3 days, and carry on so on so. Rather than telling them, oh, तुम ठीक हो जाओगे. Because if you tell them ठीक हो जाओगे और कल को नहीं ठीक होता, तो फिर then it's a problem. So I think that's why I'm saying that if we get a systematic approach to positivity, maybe spirituality, maybe positivity, it may be anything. Give them a book to read, to understand things. If they are in that state of mind, if they want to have, Japji Sahab or, or Gita or something of that sort, sure, give it to them. That will lead to positivity. So I think that is very, very important.
Dr. Sachdeva, thank you so much for opening up with us today. It really means a lot. Thank you so much.